A lot of rheumatologists use the term amplified pain.
Mhm.
A lot of pediatric pain centers use that term. It's also known as central sensitization syndrome, nosoplastic pain.
Mhm.
So it has a lot of different terms associated with it. Also, I tend to use this term amplified pain syndrome. And so, which I mentioned is this overactive nerve condition, and it involves a lot besides your nerves. So it's overactive nerves. It includes your blood vessels. There are genetics of pain. We know hormones play a role in pain. We even know the immune system plays a role in pain. When you look at populations of people with chronic pain, parts of their immune system look different from people who don't have pain.
Mhm.
So there are just so many factors to consider. And so normally, as I said, when your underlying mechanism for pain is treated, your nerves should turn off. But in this sense, these nerves continue to fire. And so normally when people have pain, we say, oh my gosh, that hurts. Well, you should rest. You should take it easy. Don't do that anymore. And if you sprained your ankle, you should rest it. But this type of pain, because it's a nerve pain, our approach to it is very opposite. And so our approach to this type of pain is if it hurts to do something, that's what you should do. And so basically working to retrain your nerves to know what normal is. And so if you start walking, so assuming your arthritis is under control and this is the nerve pain, if you start walking for a long time and your pain goes up and you quit walking because it hurt, you just told your nerves, good job, guys, high five, walking super dangerous. Next time you walk, send a huge pain signal again to make sure they stop walking.
Mhm.
On the flip side, if you start walking and your pain goes up and you know it's this amplified nerve pain and you keep going because you know it's not dangerous, yes, it hurts, but it's not dangerous, and you keep going, now you're training your nerves. Walking's not dangerous. You're the boss, and you're going to walk no matter how much they yell at you. And you're actually going to start to retrain them by doing more functional activity. And what we know about this condition is that function comes back before pain can go away. Function means being able to walk a long time, being at school every day, doing your chores, hanging out with friends, playing your sports. All of that's function. Function comes back before this type of pain can leave, which is really unfair. Ideally,
Mhm.
pain would leave and then you would do all the things you want to do. And sadly, that's not how this works. You have to do normal activity in order for pain to go.